Hello, my name is Deepthi Jayatilaka. I'm the Provincial Manager for Food Security with the Provincial Health Services Authority in British Columbia. I would like to use my presentation today to highlight how community-based food action and advocacy combined with evidence have led to a policy platform here in BC that is in turn being used to generate practice-based evidence that can further strengthen community-based food actions. I want to do this by very briefly introducing you to two policy initiatives in BC Public Health, the Community Food Action Initiative and the Food Security Core Public Health Service, and then in more detail describe some of the work that we have done and are doing to evaluate the Community Food Action Initiative. To begin with a bit of background, many of you may know that BC has had a long and illustrious history in community-based food action and advocacy. This, combined with the evidence linking food security and health, were instrumental in creating the Community Food Action Initiative in 2005 as a community-based solution to supporting healthy eating under the Healthy Eating pillar of Act Now. Around the same time, BC was undergoing public health renewal, and the same kind of conditions led to food security becoming institutionalized as a core public health function in BC. The goal of the Community Food Action Initiative, or the CFAI, is to increase food security for the BC population. And the main thrust of this is to build community capacity to respond to local issues. The goal of the Food Security Core Public Health Service is pretty much the same, but this is done through harnessing health sector leadership by engaging stakeholders both within and outside of health to undertake supportive policies, programs, services, raise public awareness, and undertake surveillance, monitoring, and evaluation activities. The partnership that delivers the two policy initiatives include the BC Ministry of Health that provides the policy framework, and in the case of CFAI also provides the funding, the 5 regional health authorities which implement the policy framework using a population health model based on regional capacities and needs, and then Provincial Health Services Authority, the health authority that has a provincial mandate, works with the BC Ministry of Health and the regional health authorities to undertake actions that can augment regional activities and then contribute to building a common agenda for food security in BC. In the CFAI, regional health authorities provide funding and other supports to their communities to undertake community food action. And when CFAI was launched, there was a multi-stakeholder provincial advisory committee that provided oversight to the whole initiative. Unfortunately, this advisory committee has been dormant in the last 2 years or so. At a provincial level, we organize ourselves to engage key stakeholders and build evidence to influence policy and support community action. In terms of building evidence, we do one of two things. We synthesize and translate current evidence for key stakeholder audiences, and then we undertake surveillance and evaluation activities to contribute to evidence. So to give you some information on some work that we've done in surveillance, last year the Provincial Health Services Authority, working in collaboration with the BC Ministry of Health and the regional health authorities, agreed to using a common set of food security indicators to monitor food security trends in BC. One of the indicators focuses on institutional food policy, one focuses on community capacity, and 4 indicators focus on some aspect of household food insecurity. It includes affordability, nutrition-related health conditions, fruit and vegetable consumption, and food security at a household level. So in terms of evaluation, when the CFAI was launched in 2005, it was launched as a 3-year initiative with a strong requirement for evaluation. PHSA was tasked with evaluating the CFAI at a provincial level. We did this from 2006 to 2008, and what we did at the time was a process evaluation. We were interested in understanding if the CFAI model worked, if it would deliver on the 5 key objectives, and if it would likely support healthier eating. We ended up with a very strong evaluation and great support for the CFAI model. So buoyed by this, the health sector actors who were involved in the evaluation were very interested in outcome evaluation of CFAI. So to facilitate that, PHSA led a process in 2008 to develop an outcome evaluation framework for CFAI. As you know, community food actions can, there's a range of them, they're very diverse, and they have the potential to deliver on a multiplicity of outcomes. And without being too aware of that, we had developed a framework that was going to do it all, evaluate all of this. And very soon we realized that what we had developed was very unfeasible to implement. So recognizing that, we put the project on hold, and just around this time we were invited to the table by the Public Health Agency of Canada, who were also interested in developing an outcome evaluation framework for community food actions. They had, through a literature review, learned that much of the food actions that are supported in health are at a community level, but the evidence linking community food action to health outcomes were not strong. So they were interested in developing a resource that would facilitate more consistent and rigorous outcome evaluations that would help to contribute to practice-based evidence. We were very interested in this project mainly because we thought this project, we could contribute to this project with the learnings that we already had from our attempt to develop an outcomes evaluation framework. So the goal of the Public Health Agency of Canada-led project was essentially to strengthen community capacity for evaluation. We wanted to assist community animators who are leading these efforts to learn from practice and improve community efforts. We wanted them to contribute to practice-based evidence, meet their accountability requirements, and more importantly, start integrating evaluation into their everyday practice. So to facilitate that, we were interested in developing a resource that would be easy to use and one that would give them all the resources that are needed to undertake a effective evaluation. And because the framework was being led through health, we were interested in assisting community-based food actions to evaluate outcomes that would improve the determinants of healthy eating, particularly for individuals and families vulnerable to food insecurity. So when BC participated in this Public Health Agency of Canada-led project, we leveraged the CFAI as a potential place of field testing the resource that we would develop together. So that's where we are at. The evaluation toolkit was developed, finalized earlier this year, and so we brought it back to BC to field test it. The field test has 3 main purposes. First and foremost, we want to test the toolkit to see if it is applicable for evaluating community food actions and to see whether it's easy to use. A second goal for us is to use this framework to develop standardized evaluation modules for a range of community food actions, where we would use common approaches, methodologies, tools, etc. for evaluating a select type of community food action, and then use these modules to develop a framework and process with roles and responsibilities of key partners identified for ongoing evaluation of CFAI in BC. The partners at the table are ourselves. We are coordinating the field test, the Public Health Agency of Canada, the BC Ministry of Health, and of course the 5 regional health authorities. We have hired a consultant team to plan and deliver the field test, and we are in the process of planning for a 2-day hands-on workshop where we will bring our partners from the regional health authorities to assess the usability of the evaluation toolkit and also plan the field test itself. The first step in the actual field test will be regional capacity building workshops, 1 in each regional health authority. So what we hope to get out of the field test are 3 things. First and foremost, information that can be used to refine and augment the toolkit. I mentioned modules, so we are looking at developing a range of standalone, standardized, tested modules to evaluate a select range of community food actions. For example, a module that can evaluate a community garden that could be used anywhere. And then using these modules, develop a feasible plan that would help us to evaluate CFAI for outcomes on an ongoing basis. So that is the end of my presentation. If you are interested in learning more about food security efforts in BC, I encourage you to visit our website, the PHSA website, and access the food security page. But more importantly, I encourage you to visit the BC Food Security Gateway, which we developed 2 years ago and continue to maintain. The purpose of the gateway is to connect visitors to current food security actions in the province undertaken by a myriad of stakeholders, but also to provide cutting-edge information to both community animators and policymakers alike. Last but not least, if you think I can be of help, please do not hesitate to email or call me. Thank you.